Hey, what's up, everyone? And I am back from the hospital. I actually got discharged the day before yesterday. I'm just doing this video as a little update. I know some of you guys don't necessarily follow on the bodybuilding site or on my Twitter, which is where I've been posting my updates lately. So, figured I'd go ahead and do a video and give you guys a little update. For those of you who don't know, on Saturday I was admitted to the hospital. I originally gone to urgent care because my leg, my right leg, well, some of you know, has always been, really big. My right leg got even bigger than normal, and it started to like really hurt. Like anytime I would touch any part of it, it would feel like I was like jamming into a bruise or something. It was pretty unpleasant. So I decided to go to urgent care. They saw how swollen it was, and their first thought was that it might have a clot. So they sent me to the emergency room so I could, get an ultrasound done and some other testing. So I got testing done. It ended up being the diagnosis officially was cellulitis, coupled with lymphedema, and that's significant because this is the first time I've ever been officially diagnosed with lymphedema. I had gone to the doctor 6 months ago. I have a recording of it on my YouTube if you guys want to check it out. I was recommended to a Dr. Jennings, and he was kind of rushed. He had to be in surgery. He didn't really, give me a lot of time or quality health care. And I asked him directly. I said, "You don't think this is lymphedema?" Because I had a strong suspicion, and he failed to diagnose it. And now they're pretty sure that it is lymphedema. The ER, they decided to admit me because I also have cellulitis, which is I was in the advanced stages of cellulitis, which is an infection. It's kind of serious. It kills 21,000 people a year, so it's definitely serious. But I gotten there in time, and they wanted to admit me so they could inject me with just a shit ton of IVs of a really strong, the most powerful antibiotic that they had. The problem was that the antibiotic causes your veins to collapse pretty quickly, or it just causes them to go bad quickly. And they had to keep stabbing me with them and keep finding veins and keep drilling in these huge gauges into my veins. And I don't know if you can see this, but they just absolutely tore up my arm. They wore out all the veins in one arm, had to go to the other arm, wore out all the veins in that, and ended up going to my hand. That coupled with shots in the stomach to prevent clotting. I had to get every 3 hours a shot in my stomach that burnt like shit. It wasn't a fun time. But, finally I was released. They had me on heavy dose of antibiotic because of my weight. The thing is, they were scared to send me home on, the normal antibiotics, the oral antibiotics, because of my size. It's hard to get the dose accurate because they can't test my blood to see how much of it I'm absorbing. But they don't want to give me too much because there's serious side effects. But they ended up going with amoxicillin. I take 2,000 milligrams twice a day, so 4,000 milligrams total a day, which is pretty high. They got me on that for 7 days, and I'm going to be following up with Dr. Cassidy. And then once the cellulitis is in check and cleared, then they're going to have me go for treatment for the lymphedema. So eventually, I might have small legs. I'm including a video with the leg comparison. I also weighed my legs, so you guys can see the difference in that, and it's pretty humongous, and you can feel it. My leg is so heavy. Just pulling it up on the couch to sleep is extremely difficult. But I'm not gonna let it hold me back. It did force me to gain some weight. I went from 416 to, I think, hold on, let me get this accurate because I don't need to attribute even one extra pound to myself that I haven't earned. I went from 416 to 424. So, yeah, I put on some weight, which I was not pleased about. But, I got back to the walking today. I decided I needed to do that a little earlier than anticipated, and it was difficult. That big leg is heavy, and it now jiggles around, so when I walk, it kind of shakes, and there's a little pain. So I had like a little limp. I like to call it a pimp walk. We'll go with pimp walk. I had a little bit of a pimp walk when I walked today, but I did make it all the way that I normally do and all the way back, so good to go. I also earned my 500-mile lifetime badge, which means that, you know, I could have walked to Chicago and back by now, so not bad. And I still plan on being into the 300s. I don't want to give a definite date, because, you know, that's always a recipe for disaster, but I'm going to get there. And you guys are going to watch me because you guys are awesome. So, bam. Much love for all you guys. Glad to be home. And I'll keep updating with medical stuff. And anyone who has watched the video this far and heard my long-winded rant, you guys are my favorite. You guys are my favorite. Alright guys, wet breaths out. Alright guys, what's up? I'm back from the hospital. I just wanted to, you know, let you guys kind of compare the legs and see what I'm looking at still. This is after swelling went down maybe a little bit, but not too much. Alright, here's my left leg. This is a normal one. Yeah, not too bad. And this is the right one. Yeah. So, a bit of a difference, you can tell. Here they are, side by side. Yeah, I don't know if you can see that with a wide angle lens, but yeah, there's a bit of a difference there. Surprisingly, I weighed them. I'll show you the results of that weigh-in after this video. But also you can see this has kind of loose skin. See how it kind of flops around. Also, I'll give you guys an update on the lipoma since I'm here. I know you guys remember that lipoma I had. Trying to pull it out here. Guess I won't. Alright, I guess I'll have to save that for a later video. My pants are a little too tight. But yeah, as you can see, it's kind of loose there, and then yeah, it's pretty filled up. I know, it's kind of disgusting, but I just wanted to show you guys just how messed up it is. So hopefully I'm going to be getting help with that. I'm going to be going to the lymphedema specialist soon. I'll discuss that a little bit more a little later in the video. Alright, see you. Alright, what up guys? Alright, so my leg is gigantic today. Check it. Oh, hold on a second, let me swap. Alright, here we go. See how nice and big that is? Well, I wanted to go ahead and take a look and see how much that thing weighs, because, you know, I'm just interested to find out, and I'm sure it's pretty high. So, right here we got this. I've got the scale here. I'm sitting on the floor right now, and I'm just going to lift my big old leg up, put it on the scale, and see how much this baby weighs. So, let's go. And we'll be able to see how much of my slight weight gain I can, you know, blame on it. Alright. Let's see. Alright, just waiting for it to tear. For some reason it's showing a negative 280 right now. Let me turn this off and back on. Alright, we're at 0. Alright, let's put this under my chin here. Let's see where we're at. Alright, I'm not pushing down or anything. I'm sitting real still. Whew, that's big. Alright, let me take it off and try again. Alright, so let's wait till we get back down there. 0. So that little haunch on it. There we go. Back down to 0. Alright. Looks like it's between 48 and 52-ish pounds. Feels heavier if you can believe it, but that's still pretty heavy. Let's compare it to the other leg. I guess that's the only way to get a fair reading. Let me move the scale here. One moment. God, moving that leg is impossible. Alright, back down to 0. Let's check out the other leg. I'm showing 30 pounds for the other leg. Man, that's not as big of a difference as I thought, but still, you know, pretty big difference. It's almost double. Feels like so much more than double, but so there you go. Inquiring minds want to know, and now we know. Peace.